order, please. For all who care to join me, let's stand and say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. We don't have any student reps because they're at open houses?
No, they are at a soccer game. However, they did their updates, and we have them to play.
Oh.
Aw.
Okay.
That's awesome. It was their idea.
That's a first.
So
I like
fun.
that.
So we do have them.
And, no, Karen, let's see, she will not be here.
And Courtney.
And Courtney is
She's
not
coming.
here thus far, but
She's coming.
she's coming. Okay. So how do we play?
Do you want to do board norms and
Board norms, okay.
I know you're excited about that, aren't you?
Lots to do before that. Okay. I'm going to read the board norms. Debate, commentary, and discussion are healthy and open. Listening and speaking are equally important, and both should be done with respect and consideration. Focus is on students and our schools, not politics. Assume best intentions in all discussions. If I could please have a motion to approve the agenda?
So moved. Second.
And I need a motion to remove the personnel memo number 668 from the agenda, from the consent agenda.
So moved.
moved.
Sure. Thank you. All in favor?
Aye.
Okay, any opposed? Motion carries. Now,
Approve the consent agenda.
a motion to approve the amended consent agenda.
So moved.
Second.
All in favor?
Aye.
Any opposed? Motion carries. Motion to amend the personnel memo number 668, is that right?
668, yep.
668, to remove appointment number 1 under the license section. Faith Mirage.
So moved.
Second. Can I have a
Second.
Second.
All in favor?
Aye.
Any opposed? Motion carries.
Now move motion to pass that.
Motion to approve the amended personnel memo number 668.
So moved.
Second.
All in favor?
Aye.
Any opposed? Motion carries. Thank you.
Did you get all that? Okay.
All right.
Okay.
Okay, good.
And now we're moving to public input. Do we have anyone who would like to speak?
No one was on the list when I checked, but did anybody else come in?
Anyone? No? Okay. We have a presentation tonight from Mr. Rich Eckroat from the Situation Table.
Staying or going? Okay, I brought Prouty for backup, just.
Thank you, Commander Prouty, for coming.
Thank you all for letting me speak to you about the Situation Table this evening. A little bit quickly about who I am and why I'm sitting in front of you. I'm the chair of the Rutland County Situation Table. I'm also the district manager of Rutland Probation and Parole. I'm an adjunct instructor of criminal justice at Castleton University, and I am also a resident of Rutland County, and I care about our people and what happens here. So the Situation Table is a multidisciplinary approach to address people that are in what's called acutely elevated risk, or AER, which basically means they're standing at the edge of a cliff. And they're going to fall off that cliff if there's not some sort of intervention that happens really quickly, soon. So what the Situation Table does is pulls them back from that cliff by surrounding them with services. And this is not a new concept. The Situation Table has been around since 2011. It was developed in Saskatchewan. It was first used in the United States in Chelsea, Mass., which is an area that was facing a lot of the same issues that we see around here all the time. Homelessness, people struggling with mental health, substance abuse, things like that. And what they saw was when they got all of the community providers to the same table and presented situations or cases, individuals or families, and took immediate action based on the risks of the individuals and families, that they were able to make a meaningful impact on the lives of them, the lives of these people, because what they were finding was that the individuals and families would reach a point where they either didn't care about the services they were getting or what happened to them, and social services would intervene, and eventually they would either accept the services or not. But the Situation Table essentially allows us to go to them literally knock on their door with a group of people who are there to address whatever risks they may be having. And we're not there, we're essentially there as a group to offer them services. Referrals for the situation table can really come from anywhere, and that's why I'm talking to the school board this evening. A lot of them are coming from law enforcement because they're dealing with people that they're seeing on a daily basis whose lives are sort of crumbling. And they know that some intervention is needed or likely something bad is going to happen. And that could mean a lot of different things. It could mean an overdose. It could mean violence. It could mean family violence, things like that, homelessness. So most of our referrals are coming from the city police right now, but we also get them from the Rutland Regional Medical Center, as well as Department of Corrections, BPA, all of our community partners. We meet every Wednesday at Rutland Probation and Parole from 1 to 2 o'clock as a group. And when I say me, I mean all of the essential service providers in Rutland County are all at this table every Wednesday. And we address cases, situations that are brought forth. And then within 24 to 48 hours, we take immediate action by making contact with the individuals or families and offering them services. Now, certainly, they're welcome to say, I'm not really interested. But what we're finding out is when we knock on their door as a group saying, hey, we're here to help you, they're very open to it. And most people do want the help that we're there to offer. And once we've sort of backed them away from that cliff, they are generally connected to the services that they need to be connected with. So when we're looking at individual cases, when cases are brought to the situation table by either law enforcement or Rutland Regional or a teacher, whoever, we're looking at what the risks are to this individual or family. And the top three that we're seeing are what you would expect. We're seeing homelessness or are at risk of losing their housing. We're seeing substance abuse issues, and we're seeing significant mental health issues. Now, there's a list of, I think, is it 110? 117 total risks categories that we can check off that an individual or family may have. Now, we haven't certainly not had somebody who checked every box, but we have had people check many, many boxes where when we're discussing the case, we start to wonder how they made it this far. Consent is a big piece of this. We operate, each individual agency coming to the table operates under their own consent protocol, whatever that looks like. So when we make a first attempt to talk to somebody about the situation table, whether it's Proudy or another officer or a caseworker at Rutland Regional Medical Center, we're approaching it as, hey, these are the people that want to help you. We need your consent to talk about you. And once we have your consent, we can go forward and kind of come up with a plan to address the needs that you're suffering right now, that you're experiencing right now. And then after that, it's, again, we discuss the case, we make contact 24 to 48 hours. And that has kind of always been the missing piece in this type of work. I've seen stuff like this before. I've been part of a long table of people talking about cases and individuals, and I'm sure all of you had before. What we have now is a requirement that within 24 to 48 hours, we are making contact with this person and beginning to wrap the services around them that they need. And a lot of this is about accountability for us, for the service providers as well. We're holding each other accountable for the work that we're supposed to be doing. So if we're supposed to be making doctor's appointments for someone or finding them housing or getting them hooked up with MAT, we're going to know about it because each week we come back and report out about what we've done for that individual or family. And it genuinely does create accountability in the system that we're working in. I have a fairly long list of the agencies that are at the table because I couldn't remember them all, but would you like me to rattle them off? It's about 20 agencies, but I think it speaks to what this is, because we have this many people at this meeting every week, and this is not something. This is in the middle of our workday. This is part of our workday. And we're all there representing a different agency, a different department, whatever. So we have the Rutland City Police, Probation and Parole, DCF, Rutland Regional Medical Center, Rutland Mental Health, Cornerstone Housing Partners, Westridge, BPA, Brock, New Story, Turning Point, Project Vision, New England, HIDA, and the Council on Aging. Did I miss anybody?
VNA and hospital.
And VNA, outstanding. So
Community health, pediatrics.
pediatrics has been there. We've had several pediatric nurses recently that have been attending the table regularly. So let that sink in. This is making a difference, and people are noticing it. To date, we started in April. We were trained in March. We started in April. We have handled 31 situations so far and helped provide services to 37 people. So that's 37 individuals or families that we've pulled back from the brink of potentially falling off that cliff. And people, the reason why there is the consistency with this, the attendance in this meeting is because it reduces all of our workload when we work together. Yeah, that's common sense. No brainer, common sense. When we all work together and kind of combine our powers, the hospital doesn't get nearly as many emergency department visits. They're not getting the same frequent flyers. They call them VIPs, very important patients. The people who are there all the time, daily, or sometimes more than once a day. We're able to reduce that, and we have been able to reduce that by actually working with the individuals and finding out what their needs are and going as a group and addressing it. So some of the highest emergency department users that we've seen, whether it's mental health or physical health, substance abuse, are not showing up at the emergency department anymore. And that may not seem like a big deal to the school board, but as a resident of Rutland County or anywhere you live, that makes a massive difference in everything, in the care that you receive as a patient, in kind of all of their jobs at the hospital are made a little bit easier because of that. And those are just some examples that we've been able to really address through the situation table. I kind of want to open it up to questions because I feel like questions are when things start to get sussed out. I see Pam shaking her head, so go ahead.
I have lots of questions.
Oh.
Can I go? Do you have a question? Me?
Oh, please.
Me turn?
Yes.
Me turn? Lots of questions. Is this a 501c3 organization? Like,
No.
How are you funded? And is there a board?
There is no board. So this, Matt, you may answer these questions a little bit better than I.
I'll come up.
Come on, sit next to me. Sit behind the pillar.
Okay, so Core Data Health Programs,
Yep,
whatever it is.
Core Data.
Is partnered with the State of Vermont's Department of Public Safety. So Governor Scott's violence reduction strategy identified, I think, 8 or 9, whatever, locations within the state where they wanted to do some investment to bring down violence, reduce harm, all those things. So they contracted with Core Data. They started in Bennington, then they went to Brattleboro, Springfield. Rutland was the 4th table. So this model now, the number 7 table is training today and tomorrow, and Thursday will be number 8. So the cost of, on the back end of it, the support that the situation table gets comes from the State of Vermont Department of Public Safety. So,
Okay, so they felt there was a need,
yes.
and so they brainstormed, some people came up with the situation table model, and now it's being implemented throughout Vermont.
Yeah, so the situation table model really got its traction in Saskatchewan and Canada. It's really big in Canada. Chelsea, Mass. was the first place to do it here in the U.S. Of course, Chelsea, if you're not aware, is 2 square miles with 60,000 people, and had some really massive issues. So they originally called it the Hub there. They ended up changing the name because of the hub and spoke models. There was a lot of confusion. So that was the first. Now there's, I think Vermont right now, by per capita, has the most situation tables in the nation.
Yeah.
But they're in Oregon, Kentucky, Montana, Rhode Island, Massachusetts, Connecticut, Vermont.
There's 150,
Yeah.
150 nationwide.
So Rutland, as an create a situation table, and someone is spearheading, this must be to get all the people to the table, because all the organizations that you spoke about are coming to the table? Like somebody from
Yeah,
each?
so I can speak to that. So I actually, do you guys remember when Maureen Kavanaugh was at the intermediate school? She did a presentation there like a couple years ago. She wrote a book, her daughter, she wrote the book as a parent having a child with suffering from addiction. And I believe her daughter went into rehab 40 times, had literally died and was brought back 12 times. And she wrote this absolutely incredible book, as a, If You Love Me. And it was basically her daughter saying, if you love me, you just let me die. But she never did. And so I met her at the Turning Point, and she got me connected with Scott Allen, who is one of the trainers for this. So we talked basically through Project Vision. I was going to try to bring the situation table to Rutland in 2023, but there was his partner, which is also another retired police chief from Massachusetts, knew Jim Baker. If you guys remember Chief Baker when he was here, they went to the FBI National Academy. That whole thing, that executive networking piece, and they got talking. And said, "Boy, this would be really cool if they could bring it to Vermont." So they told me to hold off the Public Safety Enhancement Team, the PSET for Governor Scott under Jen Morris, Commissioner Morrison's office, went into contract with these folks to bring the situation table to Rutland. So I've been chomping at the bit to bring this here for Rutland, because even though we already have like a lot of great relationships between partners with Vision and everything else, and the continuum of care, and there's all these great things, what the table brings is this actionable piece that's timely, that's addressing very specific, academically identified. These aren't risk factors that change from one state to the next. The risk factors that we're identifying here at the Rutland table, Frankfort, Kentucky is doing the same thing, Helena, Montana, Burlington, Vermont. We're all using that same piece, and it's and as we have these tables and we do the situations, all that data is de-identified, the risk factors are identified, and we're going to have actionable data to use to see how does this match up to the community health needs assessment, where are gaps in services, all those things. But so that's how things kind of started. For me, the magic, I don't want to get too far into the weeds on this, but this part's really important. What sold me on this is a 4-filter process. Okay, filter 1, I'm at my organization, I've identified somebody that's, I believe, is an acute elevated risk of harm. I do that work at RPD, you can do that at the school, Rutland Mental Health, wherever. You bring the situation, I have an individual, a female between the ages of 20-29, the risk factors are mental health, poverty, can't meet basic needs, and substance use disorder, whatever. I have consent to bring it. So we'll agree, do we have a consensus that this person has an acute elevated risk of harm? Yes. Then we'll go into filter 3, where I have consent, so I'll provide a basic brief narrative. And then we decide who on this team who here in the room should be on this filter 4 team. And say, okay, Matt Prouty, or based on the risk factors that we identified, that's how you build that filter 4 team. So we'll close the meeting. That team will now meet. Everyone else will leave. The people that weren't identified in those risk factors, they don't need to hear about anything that's happening. No case management happens at the table. That is very basic. All of the other work happens outside. So we meet after that meeting for about 10-15 minutes and come up with our game plan. What I love about this is when you take this disparate group of awesome professionals and you have to work through problems every Wednesday with multiple risk factors, multiple people, that filter 4 team changes based on the risk factors. You know how much better we're getting week by week. I'm meeting people and learning about organizations that I didn't know, and I've been in this business a long time. We're identifying rock stars that can move mountains in certain areas. We are so much more effective together, and for me, this is one of the best things that's happened to us as far as actionable work, where we get used to competing organizations that have to put maybe we're fighting for the same grant money aside because we're meeting a need. I have 4 primary care folks that come all to the table. So we actually had to come up with a plan. We're going to rotate for primary care on our filter 14, so it's not always community health or BPA or whoever. So there's magic to it, and the accountability piece that Rich said, I think is great. I don't want to be the person that comes back the next week and they say, hey, Proudy, where are you at with situation 31? Well, I kind of got busy. No. I mean, if it was at an acute elevated risk and it's that important, what else were you doing that was so important that we neglected this piece? So it really forces us to focus on what's really important, which are these vulnerable cases. It's kind of magic there, and it's not like it's this rocket science thing, right? And I also love the fact that every organization follows their own policy. If you're a 42 CFR, 42 CFR Part 2, whatever, and you have massive privacy rules around you, you follow your rules, right? We really focus on consent. Springfield, at their table, they actually had an individual go to an officer, say, will you bring me to the situation table? Because they had heard about it through others. So if you can't tell, I'm kind of excited about this whole thing.
I think it's great because it brings a way to get things escalated maybe,
Yeah.
and to focus on isolated situations, but you have a focus that seems to keep progressing because you have a follow-up as well. So people are kind of accountable to keep moving it forward to make progress, which I think is fantastic. And so there must be a lead person who is kind of managing all the cases and kind of keeping it.
So
keeping
that's the table chair.
That's me.
And the recorder.
Gotcha.
Yeah.
And they're volunteers, and that's really cool. But the lead out in the field can be multiple
Right.
different folks.
I've become the face of the situation table with Matt, only because I attended the training in April and realized, wow, this is pretty amazing. But it really is, like Matt was just about to say, it can be kind of whoever's bringing that case is leading that situation. Yes.
Do you have a lot of school children involved in these cases in general? Like, would you see the benefit of having somebody from the school there at the table?
Absolutely. And so even if we've had a couple of juveniles trickle through the situation table, even if they're not in the situation that could be affected by it. So I think anytime we can have somebody at the table who works for the school system, I think probably the best operating tables in the country have that as part of their table. It just makes so much sense. We're dealing with situation, and I think about this the other day, and I believe I said this to the group. I've dealt with so many situations in the 20 years in corrections, in the 19 years in the field, and many of the teachers and principals and administrators and counselors have dealt with those same situations, but just on a different end of it. So absolutely, our work intersects here.
Maybe be a good time for me to talk a little bit about that. So Kathy first brought this to my attention. She had heard about it at a Rotary meeting, I think. And so Rich came and talked with our administrative cabinet last Thursday. Carrie and I attended a training today, as well as Kathy and Stephanie. And Carrie, as our Director of Support Services, will be our liaison, so she'll attend the Wednesday meetings from 1 to 2. We're really excited about the active work with community partners. I think the biggest difference between what the situation table offers and what we have currently for students is the number of different agencies and resources that are at the table compared to the meetings that we have now, which are called Coordinated Service Plan and Local Interagency Team Meetings. So it's very different, but much more expanded. And so we're very excited about that. And then the other thing that we need to work on is just a system for processing when referrals want to come from education. So what is the form that we want to use? How do we want to process that information? And Carrie will be pivotal in that as we move forward.
Fantastic.
I look forward to that. I think we all do. The table is very excited to hear that. Go ahead.
Is Dina okay, and then you?
No, I was just pointing out Dina, that's all.
So I guess my question is around longevity, because I think, we've all, like you've said, have seen initiatives or programs or things kind of pop up and start, and everybody gets very excited. Do we have any understanding or information from the ones that have been already in process for a while of how to maintain the sustainability of the program? and how to create something that's long-lasting over the course of time. Because I think we've seen, I've seen in Rutland at least, a bunch of opportunities where things kind of start to build and then there's that
hard to keep
fizzling
momentum.
effect.
Yeah.
As if they had, do we know like over what has been the length of time that programs have been running, and if they've been able to sustain it in a way that is as powerful as we can all agree this can become here?
Sure. Do you want me to do this one? You got it. I mean, I think you look at when this started in Saskatchewan, 2011, still running there. Chelsea, Mass, 2014, maybe not, maybe more
It was
recent, but
2013. I remember
Yeah.
13.
been running for many years now. And that's a great question, though. But it's very easy to pass the baton. I'm burnout on this. As the representative for my agency, somebody else has to do this. So you could just build in the longevity by making sure people know what it is and that they can be there.
What I like about the table is that nobody owns the table, right? It's Rutland's table.
I think that may be the key.
Yeah.
And I think that is the key. So we have redundancy. The two really important jobs are the volunteer chair and the recorder, which we already have redundancy on. So if Rich Heston wants to go on vacation, he can do that. Doesn't feel like he's super obligated. We have that built in. The other part that I think is pretty good is that everybody that goes to the situation table and goes out to do the filter for work, that's your work anyway.
Yeah. Yep.
All we're really doing is focusing at it, and you're adding a couple partners. So
Which in the end just makes your
in the
job
end,
easier.
It makes your job easier. And for me, I mean, who wants to go to work and say, boy, I hope I really suck today, right? It's not like that. You actually have more of the, I'm sorry, this is all recorded. It's been a long day.
I forget to sometimes.
He's down.
It does it all the time. So it's that piece of, I think there's going to be far more job satisfaction out of our folks that are providing services, because we're going to be having a lot more wins. And for some of us, and working with really high needs folks, wins are far and few between sometimes. But for me, I don't feel like it's the community response team at the PD carrying the whole load right now. I have my homies, right, from these other organizations that are actually the experts in their field, and we're just doing this together. Now, what I might provide in many of the situations is nothing more than a warm handoff. I might go into space, talk to the individual that's there because I know them. We've probably known each other for a long time. I said, hey, do you mind if I introduce you to Angela or whoever else is on the team? Sure, and boom. It's that bit. It might be just being close by because an organization says, you know what, I'm not comfortable sending my staff into a certain area unless you commit to having some safety pieces in place. Fine, I'll do that. But again, look how often maybe we haven't responded, an organization hasn't responded because there's been a safety concern. It's actually more than you think. So, to me, I think on the longevity piece, that's a big part of it, is we're not alone. You're having more wins, and it's shared burden.
I think that the whole thing is helping people, which I think it's fantastic.
It's
And
preventative.
Yeah.
It's not picking up the pieces, it's stopping the
Helping people.
crisis from happening.
And I'd like
or
you to come to the
trying
Rutland
stop
Rotary
it.
Group.
Yeah.
Did you want to-
I was waiting for that.
Are there risk factors more applicable to students such as truancy that are considered?
Yes. That is actually one of them.
And then, in fact, I think the juveniles that we have that have passed through the situation table, that's been one of their risk factors.
And it's important to note, again, like I said before, the risk factors that are there, they're the same in Oregon, Kentucky, Vermont, Rhode Island. We don't have, you can't modify it. It's not this is very much a Burlington issue or a Rutland issue, and nobody else in the world has it. So when we're comparing how we're doing around the state on those social determinants of health or something equivalent to what's coming out of a community health needs assessment, we're all comparing the same risk factors. And what's neat about it is we may be able, in January, we're gonna look at all of the tables and all of those risk factors around the state and see how they differ, because they're not all exactly the same. Brattleboro and Rutland have a higher substance use disorder risk factor than maybe St. J and Bennington. But it's interesting to see that. And what's cool is we'll be able to use that data publicly and applying for grants because it's all de-identified, right? Grant applications, looking for gaps, where do we need to invest? This will be really good for us as a community and for the decision makers.
I just want, I don't have a question, but I think there's a couple of things here that are incredibly impressive, and it's knowing when to pass the baton, like you said.
Yeah, this work is exhausting.
Yeah, I'm exhausted thinking about what you all are doing on Wednesday between 1 and 2. Like, it is a time that I will think of you for sure, and it's, and I like more wins and shared burdens. I mean, who doesn't want that? Like, the burden of what these 28 agencies carry every day, I literally can't fathom it, right? And what our teachers face, and if this can get us more wins, and
Yeah.
it seems no-brainer-esque, right? So, yeah, thank you. Thank you.
So the people come to the table once a week?
Mhm.
And then how often do the tables meet? Like the Rutland table with a Brattleboro table?
We meet, I shouldn't say we don't meet, because we do meet on teams. We don't meet as a big group, but we do meet monthly. Are we doing that monthly
Yeah,
right
we
now?
actually have one on Thursday.
Yeah.
All the Vermont tables will table chairs.
Convene.
And we will convene, and we're gonna talk about how things are going, challenges, things like that.
Right. How do we hand off a case
Mentoring.
Certain
from one?
teams work really well in certain situations that you could learn from, I suppose.
Sure, absolutely.
Yes.
Yeah. And that's
That information
part of
around.
that meeting is just information sharing, what's working, what's not. How do we pass a situation from one county to another? What's the easiest
So
way to do
you're
that?
the first chair.
Mm-hmm.
And is there a term, or do you just keep going until you're saying you're?
Until I get fired? I don't know. No, I mean,
Well, there's another probation and parole director in another community that I'm sure Rich is going nowhere until that one goes.
So essentially, you
through.
could just be the chair.
I could ride this
quite
out.
a long time.
I got a few years left.
I mean,
in
that's
me.
great. I
Yeah.
just
I
wondering-
will, quite frankly, I love doing it. I really enjoy it. The first time I saw it work, holy moly, we're doing something. So no, I will be part of it for as long as I can.
That's great. That's good.
I'll hand over here. I also know that we're running out of time. No? Do we have a hand over here?
I wanted to just say that as community members, that if we know someone or come across someone who could benefit from the table, we would just call the community response team
How you want
at
that,
the
Matt?
police department.
Yeah, they can talk to Eric and.
Yep.
So our community response team, well, essentially they're 2 female officers, I believe.
So those are the community resource specialists.
Thank you,
So, at the training, Sergeant Morgano, you met him. He's the supervisor of that unit.
Oh, okay,
so
okay.
I
So,
got to
and
quickly
he's-
give them a lot of credit.
yeah,
They are
he-
awesome.
They are awesome.
They are awesome. I didn't know how awesome they were until the situation table, by the way.
So he said, Sergeant Morgano said that any community member can call the precinct and ask for the community resource specialists and tell them what's going on, and they can bring that individual or family to the table. So I just wanted to make sure that everyone, as community members, have that information.
And another thing as well, is that like you guys, it was talked about today as a script. Like,
Yes,
you're asking
scripted, yeah.
the same questions as the team leader of, of the factors.
Yeah.
So you want to talk about that a little
It's
bit?
the same exact meeting no matter where, again.
Yeah.
Oregon, Texas, wherever. Saskatchewan's the same. It sounds exactly the same no matter where you are. It starts off with introductions around the table, and then we just go through the script. Let's review situations from last week. Does anybody have any new situations to present? And then I ask the same questions related to their acutely elevated risk. And then does the group agree that they're in AER? And we go right through, just like every other table around the country is doing.
So other states have been doing this
Yeah.
for a while.
Yep.
And we just got on board.
We did.
We did. Thanks to that
And
guy.
very quickly have
Thanks
become
to-
the most per capita in the nation. So Vermont's really doing well on this. So
Great. And I'll just add that several times today, Rutland was given shout-outs or accolades for our high-performing systems, and Matt was especially called on several times to give his feedback and information about how Rutland handles things. So thank you both for all of your work with it.
And
Absolutely.
the other thing, takeaway too, is, Commander Prouty is, with his passion, and you can see it, and that's how, there was 75 of us in this room today, and the passion that he has, that's what this entire room of 75 people were, and it was from ministers to superintendents to, in everybody in between. It wasn't just, a couple fields. It was just to see the dynamic of what was in that room. It was, and I just learned about this like 3 weeks ago, and it's a pretty amazing, and I think one of the takeaways that I actually wrote down was action and accountability, because that's what it is. You don't want to go, like you said, go next week and say, I didn't do anything. So it helps.
Well, your enthusiasm for it makes me enthusiastic for you,
Great.
for everyone. Yes.
And I'm going to pass around you guys for you, because this is what I took, this was our thing from today, so you guys can see some other, look and read, and if we want to make photocopies, you guys can have a copy. So, and it does talk about some of the risk factors. There's I think 30 of them in there.
Thank you so much, both of
You're
you,
very
for
welcome.
coming and joining us.
Thank you.
and
Absolutely. Thank you.
Yeah, thanks.
Educating
Have a good
us
evening,
on the
everybody.
table.
Thank you.
Yeah, thank
Yeah.
you.
Now we can do the student reports. I'm so excited to get going with that. I forgot everything. That's really good.
Hey, this is Amelia, and this is the September School Board Report. For Rutland Intermediate School, as we settle into our routines, we're encouraging all students to take pride in our school by working together to keep our spaces clean and respectful. This year, classes will have the opportunity to earn the Golden Spatula, Golden Plunger, and Golden Trash Can, fun awards that recognize teamwork and responsibility in keeping our school community shining. The students have been doing a fabulous job with the routines and creating a positive learning environment for all. Mark your calendars. Open house will take place on Tuesday, September 17th. We'll kick things off with a bite to eat in the cafeteria at 5:15 p.m., followed by the open house beginning at 6 p.m. You will be able to visit all areas of the school during this time. We can't wait to see you there. Northeast is off to a great start of the school year, with students and staff settling into classroom and school-wide routines. Our Positive Students program kicked off earlier this week, with students taking on more responsibilities, such as helping in the cafeteria and being responsible for the American flag. We look forward to seeing how increased student responsibility impacts positive student behavior this year, and continuing our Pizza with the Principal Fridays after students have spent all week helping across the school. Be on the lookout for more information about our exciting Lifetime Sports program, Northeast Trailblazers, an extension of our physical education department. We are excited to be promoting more movement in our students' daily learning experience. We look forward to connecting with families at our open house and ice cream social on September 10th at 5:30 p.m., hosted in partnership with our PTC. A Title I family meeting will take place beforehand at 5 p.m. We hope to see you there. Northwest is also off to a great start. Teachers and students have been working hard to build and practice routines while reviewing school-wide expectations. Our youngest learners in kindergarten have begun their first full week and are learning all about what it means to be a student. We are also excited to launch our Lifetime Sports program this week. On Mondays, Mr. Coopoli is kicking off the program off by taking each second grade class to Georgetti Park with a focus on mountain biking. He is eager to introduce the students to the backyard opportunities for recreation and learning available right in our own backyard. We would like to invite families to our open house on Wednesday, September 24th at 6 p.m. This event is a wonderful opportunity for families to meet their child's teachers and see their learning spaces. Prior to the open house, we will host our annual Title I family engagement meeting at 5:50 p.m. We hope to see you there.
Hi, this is the school report for September 9th, 2025. From Stafford Technical Center, we recently held our elections for student representatives on our regional advisory board. I am pleased to share that our first-year rep will be Colin Beatty, a junior from Pulteney High School in our Health Careers program, and our second-year rep will be Piper Newman, a senior from Rutland High School. Piper is in the second year of our Health Careers program. They will be joining our returning member, Taylor Murphy. Taylor is a senior at Mill River and enrolled in the second year of Public Safety and Criminal Justice. Programs are bustling here at Stafford. Students in many of our programs are focused on their safety certifications so that they may begin working in our labs. Students recently learned how to fabricate. Electrical and plumbing students completed a roof goal, which resulted in some very creative transfers of power, and our engineers built bicycles as part of the review of the engine. So many of them are happening in the first. Our back to school night will be held on September 6 to 8 p.m. We invite you to visit and join us at our and from Rutland High School. Rutland swing. We started the year with
Must be buffering.
Rutland High School is back in full. The year with a series of advisors to get the year started off. In those meetings, we reviewed some of the school expectations, requirements, behavior, and with the freshmen, we reviewed in the high school compared to their previous assembly. Members of Key Club talked about this year we are partnering with this lighthouse, which highlights the importance of social emotional learning. At the school have lighthouse stickers up of their willingness to talk to students and to be a support.
We were wondering if it might be a buffering, if it was.
Just need to catch
Yeah.
up.
Do you want to try it again?
Do you want to try it again?
Sure.
Okay.
Try it again. So the first one works, so we'll go
Our
with.
programs are focused on their safety certification.
If you could pause maybe
In our labs.
and let it catch up. Something might be trying to catch up and
Students recently learned how
maybe not.
I know,
I
I
was
thought the same
wondering if
thing.
there was like
Same
a
thing.
call going through
have it in
it
writing,
or
I can read it.
something.
What's that?
You want someone to read them?
Sure, I think
The
if we.
first one worked, right?
The first one was okay, but I think the Rutland High School one was the one that was,
And
And Stafford.
Rutland. I'll read those three schools.
thank you.
In case you missed anything. Stafford Technical Center. We recently held our elections for student representative on our regional advisory board. I am pleased to share that the first-year rep will be Colin Beatty, a junior from Pulteney High School in our Health Careers program, and the second-year rep will be Piper Newman, a senior from Rutland High School. Piper is the second year of our Health Careers program. They will join our returning member, Taylor Murphy. Taylor is a senior at Mill River and enrolled in the second year of Public Safety and Criminal Justice. Programs are bustling here at Stafford. Students in many of our programs are focused on their safety certifications so that they may begin working in our labs. Our culinary students recently learned how to fabricate chickens. Electrical and plumbing students completed a Rube Goldberg challenge, which resulted in some very creative structures and transfers of power. And our Engineering 2 students built bicycles as a part of their review of their engineering design process. So many amazing things are happening in the first weeks of school. Our back-to-school night will be held on September 25th from 6 to 8 p.m. We invite you to visit and join us in our barbecue at 7. Before I read the middle school, I'll just note that the Rutland Intermediate School is actually Wednesday, September 17th. It said Tuesday, it's actually a Wednesday, September 17th. Rutland Middle School. The entire RMS community went to Pittsford Rec on Friday for a great day of community building. We went hiking, swimming, played tons of games, and enjoyed a barbecue. Our Far Out program is in full swing. This program gives us a chance to offer both enrichment activities as well as small group targeted instruction in reading and math skills. All students will have an opportunity to choose an enrichment and rotate through intervention throughout the year. Our community barbecue kickball and open house is this Thursday at 5:30. Hope to see you there. Rutland High School. RHS is back in full swing. We started the year with a series of advisories and class assemblies to get the year started off on the right foot. In those meetings, we reviewed some of the school expectations, including graduation requirements, behavior, and HHB, which is hazing, harassment, and bullying prevention. With the freshmen, we reviewed some of the things that are different in the high school compared to their previous schools. In each assembly, members of Key Club talked about an initiative this year. We are partnering with an organization called Erica's Lighthouse, which highlights the importance of good mental health and social emotional learning. Teachers throughout the school have Lighthouse stickers outside their rooms as indications of their willingness to talk with students about their mental health and to be a support should they need a helping hand. Our open house is scheduled for September 18th. Don't miss out on this opportunity to meet your students' teachers and learn what they will be doing this year.
Do you have a time? Is there a time?
Thank you.
That one is at 6 p.m., Rutland High School's open house. And if anyone missed those open house dates, we can certainly get those.
I actually have them all, so I can send it to you guys. I put it and sent it to a few people already.
We could probably add them to the next.
Yeah, that'd be great. Add them to the minutes, and if you didn't mind sending them out to everyone, that would be super. Okay, so moving on, Marie Gilman with Tapestry and Epic program update.
Thank you. I always have to hand you something to look at, so I don't have to say it all. Thank you so much for having me. Marie Gilman, Tapestry and Epic. I was kind of tickled when I realized that I was here in June, and now I'm here in September. So we get to, there we go, close and open the year. Thank you. So I'm going to be brief because I don't want to take up too much of your time, but I appreciate your giving me some time and attention twice a year. These programs, I feel, and many of us feel, are very, very important. I'm going to share a couple of highlights with you. I just passed out some highlights with you. I could talk, so anybody can tell you I could talk about this forever, but I just want to hit some high points and then if you guys have questions. So when I was here in June, we had a site visit from the state and from a peer program, 21C program, to our Tapestry program. And I wanted to highlight a couple of things out of that visit. But I always like to start with, why do we do this work? So I'm not going to read this slide, but it's important to know that our focus is to have kids engage with us for 90 hours or more in a year. Research has shown that if kids engage with us at that level, their attendance in school, their engagement in school, their learning benefits. So that is it's not our minimum, but that's what we're trying to get every kid to or beyond. I have some data from summer that I was compiling before I came down because it's important to think about that. And just as one example, at the intermediate school this summer, we actually served, this is just the intermediate school, we served 160 kids this summer, and 92% of them were with us 90 hours or more. So we're off to a pretty good start for 25-26. We have 70 kids enrolled there right now going into school year, and we have some on a waiting list as we're trying to hire more people. You always hear me say that, you're hearing it again. But the reason we're doing this year is because, again, the demand is greater than what we have staff for so far. So that's a good problem to have. We're happy with that. And it shows when you look at a process measure like 160 kids participating, you wouldn't have 160 kids participating and 90% of them for 90 hours or more if it wasn't quality work that they were being exposed to. So some quick successes and achievements program-wide are on this slide. In our Tapestry programs, which are the licensed, childcare licensed programs, we are evaluated all the time, every year, and then every 3 years we have to re-up for what's basically a consumer quality rating, 5-star. We submitted these back in January. The intermediate school was the first one to come back at 5 stars. Not a surprise. We're waiting on Northeast and Northwest, but we're not concerned based on the feedback we've already gotten from the state. They just haven't sent us the email yet that says we're getting that. It's important for a number of reasons. One, it speaks to the safety, the quality, everything else that we offer, but it also helps with making sure that we are paid by the state at the highest level possible for the service that we're providing. So that helps us make sure that every kid has access to the program regardless of circumstance. All of our programs opened yesterday, K to 12. Not sure that's ever happened before. Typically, the high school in particular is usually a couple of weeks behind because the focus is so much on tutoring and homework help. But we really wanted to come out of the gate with the clubs and having the library open as a transition space day one. Part of the reason that was successful, you see a bullet there, we have new leadership at both the high school and the middle school. So you may recall in June I talked about our EPIC grant that we just received effective July 1. One of the functions there is one of those 30-hour full-time positions. We were fortunate to hire someone a couple weeks before school, and so she's based out of the high school and had already started connecting with folks at the high school and community partners to start building programming even more robust this year. We have, at the time of this writing, 14 community partners, but we've added a few more since then, because the more we talk with people, just like the energy we had from these gentlemen about the situation table, the more people want to get involved in what we're doing and bringing really cool things to kids. So we're continuing to build that out. One key point, we are measured on this. We had 7 licensed teachers at the RIS Tapestry program this year. 4 of them were our own from RIS. So that was a big step for us and for them, and they had feedback was they had a really wonderful experience. So they're looking at coming back in pieces during the year, definitely next summer. I'm not going to go over this slide because I showed it to you in June. I just wanted to put it in front of you to switch gears to the EPIC program and the new activities and vision that we have for that program. Really getting kids engaged on a whole new level, but with the understanding and appreciation that no matter what we're doing, getting them ready for the workforce, confidence-wise, washing their clothes in the laundry, learning these life skills still does help with improving math and reading. And I know we're going to talk about that more later today, but we had adopted those improvements and measures from the school-wide plans right into our grants, both Tapestry and EPIC. So we are mirroring everything that we're talking about here.
I have a quick question right there.
Mm-hmm.
Are you guys with EPIC? Are you guys at the high school level? Are you utilizing the space, the new life skills classroom?
Mm-hmm. We will be. Yes, we're not quite there yet. And at the middle school, they were doing that this summer. They were actually teaching kids how to do laundry and things like that. So, and they were really excited about it. It was pretty cool. So this, I don't like slides that are this packed, and I apologize, but I wanted you to have one slide that tomorrow you could go back and look at. I have piles of data. These are high points.
In Tapestry, they are things that we've been watching since our grant started 2 years ago. We're in the third year now. Epic, of course, these are baselines because we restarted July 1 with a new 5-year grant. But when we go back and look at 24-25, this is a number I share with you every year. In that July 1 to June 30 period, we served 641 kids last year, K to 12. That totals engagement of kids in our programs for almost 72,000 hours. That's a lot of time. So we're very, very, very busy. One of our process measures for Tapestry is to serve 50% of the K to 4 population. Why? Because if we can get them K to 4, we hope to hold on to them, and we're doing a very good job of that in the last 2 to 3 years. Our goal for 24-25 was 145 students. Needless to say, we blew that out of the water. I think we've already met our goal for this year, just based on summer alone. So I'm going to have to rescale those goals a little bit. Again, good problem to have.
Are those hours for a year, or what are we talking, 12 months? That's including the summer?
Yes, we have to report that to the state, and it's just a really interesting number. It is.
Because the summer, I would think, would be a bigger block of time.
It can be, but it depends on how many kids you have. When you look at our school year versus summer, September through late March, early April is equal to the amount of time they spend in summer. So they're pretty comparable but you have to have the student population to equal that, because it's adding all the hours that students spent in the program, not the hours that the program is open.
Okay. And is it generally the same students that are participating in the summer programs as during the year, or you have more students in the summer, a variety, or more during the year?
I haven't looked at this year's numbers yet, but in the last couple of years, about 50% of our kids from school year participate in summer, and then it changes again when they come back into the school year. So we were reporting only on 12-month periods. We're going back to reporting on summer versus school year. We've always tracked it that way because it's very interesting to watch things like what you were talking about. Who are the kids that are with us only in the summer, and who are the kids that are only with us in the school year, and try to dig into why. How do we get maybe more consistency, but at the same time under 21C, we're actually challenged to make sure that we're serving as many kids as possible. So you want to have that diversity throughout the year. It's kind of a rub, to be honest. Does that help?
Yep.
Okay.
Thank you.
When we look, and Bethany, of course, is critical in this work, we have been looking for months at different data points, and we found for our Tapestry kids, K to 6, that for reading, kids in our program, 84% of them showed growth from fall to spring. And our kids in our program are K to 6, so you have to break this down by grade too later on, but that was too much for one slide. They have achieved proficiency in that, or, are measuring at proficiency in that timetable. Math, we have 82 and 40. So how that compares back to grade level and back to, schools is going to be a little bit different, but what it demonstrates as we look at it in different levels and different details is kids participating in our programs are scoring higher than their non-Tapestry peers. That's why we're here, is to help with those things. So we're beginning to be able to collect that kind of measurable, reportable data to demonstrate that, which will be really helpful. We have baselines that we've established for EPIC again, 21C. We're expected to serve at least 50% of the population of any school that we're operating in. And we're close, but not quite there. And we're hoping these programs will bring us over the top, exceed that. So, and then you want to have of the kids, so if we have 170 kids at RMS that we're serving in a year, in 3-4 years from now. We want to make sure half of those are at least meeting that 90-hour mark. So it's not just getting them in the door, it's really engaging them and keeping them there. And then we'll be looking at math scores and reading scores as well, but just trying to give you something there as a benchmark. Any questions on that I didn't cover? Okay. We have anecdotal evidence about how the programs are working. I handed out to you some survey results from this past spring and summer. Parents and guardians, staff, and kids are represented in those. Some themes that we were really impressed with, especially from the parents after summer program this year, was how many referred to how much learning their kids had over the summer. We haven't really seen that identified so specifically. I still always love the one, and it came up, you see this here from our interview notes from the March site visit, they sneak that education in while they're having fun. So they, I've said it before, they don't really know they're learning. Why I included these notes on this slide is because we brought 3 parents in to be interviewed by this team. They were parents that I just tried to get somebody from Northeast, someone from Northwest, and someone from RIS to be interviewed. Had no idea what questions they were going to ask, so therefore no way to script them. Knocked it out of the park. Absolutely bowled over our interviewers, and these are the types of comments that they shared. So I thought you might be interested in seeing some of that as well. I shared this with you in June, so again, I'm not going to go into it, but I do like to make sure that you know that we are financially viable, and we pay very close attention to this and work very closely with our friends in the business office to manage our funds and how we're spending them. So really, that's pretty much what I had for you tonight, unless you had other questions for me.
Well, I just want to say thank you. It's remarkable how you've built Tapestry and Epic to the point where it is for the students, but I also, when my kids were Tapestry kids, and it gave me just a huge sense of, relief to know that my kids had a place to go after school. It just reduced my stress level, and to have a program of such high quality is it's immeasurable value to our community. So thank you.
You're welcome.
Thank
We're
you.
happy to do it.
Yeah.
We love it. I did want to address, you brought up, Charlene, in June about models. I went back and looked because I answered your question that day, but I didn't have any facts, that when we wrote the EPIC grant, we actually looked at 19 different models. I am not one to reinvent the wheel, maybe tweak it a little bit, but we definitely want to steal, borrow, and adapt rather than create and test and possibly be wrong. So yes, we very much rely on that, as well as all of the assessment and the evaluation of our programs internally, externally. It never ends. It's all great, but it's a lot. So other questions, thoughts?
Thank you for that.
Okay, thank you.
Thank you. Thank you.
Have an enjoyable school year.
It's off to a good start. Thank you.
Ready? For the superintendent's report, I have just a few items, just so we can keep it brief, so that there's ample time for the report on the strategic plan. So at the last meeting, we talked a little bit about a hiring update, so I went back and made sure that we had everything listed. We currently have a math and science position open at the middle school. We're in the final stages of securing a counselor for the intermediate school and an interventionist at Rutland High School. We are in need of educational support professionals, also known as paraeducators, across the board in all of our buildings and programs. We have 2 bus driver openings, and we need a bus aide. We also have a part-time tutor open and a credit recovery coach at Rutland High School. And then we do need guest teachers and educational support professionals. So subs, as they're more routinely called. Yeah, a guest teacher. Come on
That's
in.
what they were called now.
And then we do have Tapestry and Epic group leaders, assistants, student and family engagement coordinators, all available. I'm going to point out a couple of events that are coming in the very near future. The first full board meeting of the Regional Advisory Board for Stafford is tomorrow morning. Looking forward to that meeting and the collaboration that's to come from that. Thanks to Stephanie for serving on that board. And then Thursday morning, I'm doing a presentation to the Rutland South Rotary Club focused on our strategic plan and the roadmap that it provides for pathways to success for our kids. And there we go. Bianca and I are going to present the strategic plan with Jen McNeil now. Great. You're welcome. As Bianca's getting set up, I'll just give you just a baseline for those folks that are new or that don't have this information before. Last year was our first year of implementation of our strategic plan, which of course came after our Portrait of a Graduate work, which you can see the visual there, and an equity audit. And so in the development of our strategic plan, we had lots of input from our community partners, from our teachers and our staff, from the board, and of course our students and their families. And the strategic plan was really created to provide a roadmap for us to lead to student growth. All right, ready? There are three priorities in our strategic plan: the teaching and learning and wellness through inclusive school communities, and our resources for success. Tonight, we're going to focus just on the priority, I shouldn't say just, but on the priority teaching and learning. And that's really because it's quite comprehensive and multifaceted and multi-layered. It's structured to provide all students access to high-quality education and content based on standards. It focuses on clearly identifying student learning, also known as assessment, and it supports students' growth towards our Portrait of a Graduate traits.
Yes, so teaching and learning is a realm that I sort of lead in the district. The strategic plan really gets into learning systems, assessment, and student agency. If you look at any of these areas, the strategies and goals that are outlined in the strategic plan are pretty in-depth and really are multi-year goals. So we've spent a lot of time in the last 6 months especially, but definitely as we've moved out of the end of last school year and into the beginning of this school year, really looking to identify what is the right work for us to really focus on this year. And so we're going to sort of talk about what we did leading up to last year, and then we'll kind of lay the groundwork for really what we need to emphasize this year. So our year one highlights in teaching and learning, and some of this will be familiar to those of you who were here for the end of the year update. We have some draft documents that we are reviewing with our administrative cabinet, including an assessment guide or glossary, and some of our Portrait of a Graduate connections. We also completed an instructional day time audit to look at how we're using our time with our students and how our teachers are using their time. And we also did a communication survey to look at some tools that we might use to help ensure that we're communicating cohesively across our different grade levels. And so, you know, we did also have some carryover into the resources section. For example, Seesaw is a tool we were using K2. We decided to move that up K through 6 for some consistency for our families. And it's not really an appropriate tool to use in middle and high school, but it is something that we're using in those elementary grades. We have made some curriculum adjustments, specifically in the area of literacy, which we'll talk about later on. A lot of that is connected to Act 139, which I will also give a brief update of. And that changed our programming in terms of phonics instruction K through 4 for this year. We also have an increased focus on MTSS, which is our multi-tiered system of supports, and you will see that some of these acronyms are more spelled out later on in other slides. With the formation last year of a coach position halfway through the year, and then we moved that into a coordinator position this year, which Jen has stepped in to fill. Jen is a long-time math teacher at Rutland High School and is now serving as the coordinator K through 12 for the district. And that increased and we also looked at increasing the capacity for intervention supports. So as Pam just noted, for example, Rutland High School, we are moving a candidate. We are in the final stages of moving a candidate forward to serve as an interventionist at the high school. And we had many professional development offerings that I will talk about. I talked about some of them at the board meeting a couple of weeks ago, and I'll sort of flesh those out a little bit later on in this presentation.
So as we think about our students and our system, we thought it might be helpful to give you some demographic and some context information. So you'll see on the slide, we have 7.2 of our students are experiencing homelessness. We have 4.2% of our students are multilingual learners. And our poverty rates range from between 65% and 84%, and that's as defined by the Agency of Education. A few more, we have 51% of our students receive support or accommodations through a formal plan, whether they're eligible for special education or they receive accommodations through Section 504 of the Rehabilitation Act, or they have accommodations and supports through Educational Support Team Plan, which is a Vermont law that helps students get support that they need with or without a disability. And then it's just important to note that only about 50% of our students attended a pre-K program before entering kindergarten last year.
Can I ask a question?
Sure.
regarding this?
Yeah.
51% of students receiving support through a formal plan.
Yeah.
So 51% of K through 12 students
Indeed.
have a plan.
Yes. And you'll see why when you see the data. So the data that we're going to share with you next is going to outline the percentage of students who are exceeding grade level standards, those students that are at some risk of not meeting grade level standards, some who are meeting grade level standards, and those that are at high risk of not meeting grade level expectations. It's really important for you to keep in mind that it is just one data point that we use to help identify students in need. Last year was the first year that all students in grades K through 9 participated in this nationally normed screening. And really, last year, the goal was to establish some baseline data from which to analyze trends and then set goals moving forward. So this is the data for our literacy scores.
High risk for, how do you finish that?
Yep, so high risk for not meeting grade level expectations.
Okay.
Yeah.
And this is followed by the graduating class, not the individual grade, correct?
It's by grade. So this was last year's spring data.
Right.
And so it is the, for example, the first graders from last year.
Right.
So this
And
fifth
this was
grade, they're in
year-end
sixth
data.
grade now.
Correct.
This fifth grade,
Yep.
these kids are in sixth grade now.
That's right. So as I shared a couple of minutes ago, this data represents students at various levels that are meeting the grade level standards. As I said, it's data that was collected last spring, and it's only one measurement. The screening is nationally normed, so it's comparing our students to nationally against their same grade peers. We are administering the assessment again this fall, and then we will compare growth over the school year. If you want to show the math as well, so this is the math scores, again, same criteria, whether they're above grade level expectations, meeting expectations, having some risk of not meeting expectations, and then students that are at high risk for not meeting expectations. To just give you some observations about the data, the percentage of students that are at high risk for not achieving grade level standards is equal to or higher in all grades in literacy. So students, there's a higher risk of them not meeting their grade level standards in literacy in comparison to math across all grade levels. The percentage of students that are exceeding the standards in kindergarten is lower when compared to all other grade levels. Again, you could draw an inference that only 50% of our students attend a pre-K program.
Mm-hmm.
Therefore, their assessments aren't showing that there are students exceeding the standard in kindergarten. Another inference that can be made when you look at both grade 5 literacy and math data. 5 years ago, the year 2000, I think we all know where we were, and they experienced an interruption in their early learning during the pandemic. So it might be helpful for you also to know what we do when a student shows on an assessment or on a screening that they're struggling. And so we dive deeper because this is only one measure. We might look at, we work further with the student, of course, but we also might look at their classroom performance or administer additional screenings or assessments. Sometimes the assessments we see are impacted by student engagement or how much they want to put into the assessment. And sometimes we notice that there is a true gap in learning. As students become more accustomed to taking the assessment, and I'll say especially for the upper grades, I suspect we'll have much better test reliability moving forward. So in the next presentation, the next portion of the presentation, Jen and Bianca are going to talk about some of the strategies and interventions and things that we're using to help impact these scores. And then we'll wrap up with talking about what are our specific goals with student performance moving forward.
Yeah, so you've probably heard me talk a little bit about Act 139 previously, and maybe you have heard about this in other places as well. This was a law in 2024. Certain aspects of it went into effect last July, and others have gone into effect July 1st of this year. Basically, this law requires evidence-based science of reading instruction K through 3. Focusing specifically on 5 reading components: phonetic awareness, phonics, fluency, vocabulary, and comprehension. And the law also mandates universal screening. So the data that Pam was just referring to is based on a universal screener. As with many laws, the state leaves a lot open to individual districts in terms of interpretation and how they're going to actually follow that law. So, for example, the universal screener that a district decides to use, it's kind of up to the district. There is a recommended list that came out by the Agency of Education. The one we use is on that list. And but at this time, they're not saying everyone in the state needs to use the same screener. They are providing some information about which screeners they recommend that you use based on research and what those screeners are screening, et cetera. So the law from 2024 says everyone K through 3 has to have this universal screening, and parents need to be notified if their students are significantly below grade level. So we would classify them as struggling readers, and then we would provide supplemental instruction for all students with significant reading deficits and professional development for educators to help implement those practices. Specifically, the professional development is also about how to use the screening assessment tools. Surprisingly, at the very end of June, after all of our teachers had gone away for the summer and we had long passed our budget, there was an amendment to this law that said, well, actually, we'd like to expand this a little bit. Not all aspects of it, but the state decided to expand certain requirements specific to reading instruction in schools. The key changes are that the law now applies to all students in grades kindergarten through 12th grade, not just K through 3, in regard to requiring supplemental reading instruction for any students whose reading skills are significantly below grade level. I believe there are nuances in there, like the school has to communicate with families and offer some additional reading instruction. It also mandates that the schools provide information to parents about the reading proficiency of their child based on valid and reliable assessments. Okay, so again, there is no set recommendation. In fact, districts could say, we're going to use a local common assessment to determine how our students are doing with reading, and we're going to base our feedback on that. The FastBridge assessment that Pam was just reviewing the data for is an assessment we give 3 times a year. So we have a fall testing window, a winter, and a spring. The assessment obviously changes as the year goes on. And we had implemented that last year K through 9. This year, our plan was to roll that up K through 10, which has happened. And then we received this information, and so we're currently working with the high school to determine what is the appropriate assessment for 11th and 12th grade students, and how are we going to roll out that assessment. Anyone who's really done any work with assessing students, you know that there's a lot of things that can impact assessment. So even when we participate in our VT caps, which is the Vermont State Standardized Assessment, you know, we look at testing location, time of day, all these other contributing factors. Sometimes we might say, you know what, if we're going to give a student a science test, it might be better if they're in a science classroom, for example, or with a teacher that they recognize as being a science teacher. Not that the teacher is helping in any way, they're simply proctoring the test. But there's a lot of research out there that could affect students and their test taking and their one time doing a test, which is why when Pam was speaking about taking that deep dive into that data, we're not just looking at one data point. We are looking at multiple data points for an individual student, testing conditions, all kinds of things that might feed into that information, and the whole child. How are we supporting that whole child with the information that we have? So we are exploring. Not every 11th or 12th grade student has an English class. Not that reading is only the responsibility of our English department, but they don't have one every day all year in 11th and 12th grade. They do take an English class. So really trying to figure out, okay, with this amendment, what does that mean for us and how we're going to implement this instruction?
Just speak to one other, go ahead.
I think mine's just quick. So, this amendment is like a July 1, like it was immediate, like.
Kind of, yep.
Okay, yeah, okay.
I think it's a huge shift thinking about high school instruction. The certification for teachers grades 7 through 12 for English is very different than what you might have for a teacher K through 6 in teaching literacy. So thinking about our system and how to build in reading instruction at the high school, middle and high school levels.
I'll just expand on that to say the people most qualified at the secondary level to provide reading instruction are usually special educators or reading specialists. The current Vermont licensure, where you are most likely to have the most professional development, like before you enter the profession, would be elementary educators or special educators, not some of the current licensing endorsements. So the state is even working to adjust which endorsements are available now for educators at different grade levels. We are continuing with more information.
Okay, so this is kind of an epic question as well. It's a combination question. So when Marie spoke, she, one of the data points that she gave us is, I believe, kind of different from this. So what is Epic not using? You guys are using two different types of numbers to come up with the data points? So
I'm not
your
sure
numbers
what
are her numbers?
Marie used for her data.
It was fast-paced data too.
Okay.
So she looked solely, the difference, correct me if I'm wrong, she looked solely at students who attend Tapestry.
Okay.
And to see the Tapestry students, where are they at?
Yeah.
But not by grade level or Tapestry as a whole?
No, I mean, you had to pull it by grade level, and then it was
an average.
Smushed together.
Yeah, it was smushed together, but we will be bringing that back apart as we move forward too. I just wanted to have something to show you tonight, so it was higher level.
So.
It's not apples and apples, you're right.
Okay.
I think one thing that we will be careful about is when Marie dissects the data, as far as numbers go, there might be only a smaller subset that attends Tapestry in the 3rd grade. So reporting out that information will not be at grade level for Tapestry data.
And will there be some kind of communication between the two to help work with the students who need that extra?
That is a great question. Marie and I were chatting about this today and for a long time. Some of our grant money, our title money, we do utilize not only to support school day, but to also support beyond school day. including, for example, any tutoring that would come through the Tapestry and EPIC programs. And so those programs we've intentionally paused getting up and off the ground because we need to think about, which Jen is going to be talking about, our multi-tiered system of support and how we are ensuring that, first off, that if a student is in need of additional supplemental instruction, that we're not saying, oh, good, you can get that outside of the school day, but that's part of their school day. But hey, if you're also interested in doing that outside of the school day, this is how we want that to look, and we want to make sure we're intentional about that work to assure that it's aligned. And I'll kind of talk about how we're working to bring things into alignment to help where we're currently at, to help us be able to make sure we are using our resources to support that work in a very intentional way.
Thank you.
Charlene has a question for you.
Yes.
More of my observation, and I've only had a couple of minutes to, obviously, to look at these numbers, but I guess some of the things that I'm taking from it, just some observations are, we're noticing, okay, so if grade 5 is impacted, let's say by COVID, we have new students coming in at the lower levels that are after the COVID mark that still have high-risk marks, so it's alarming to me a bit. And when I look at the kids that are up in 6th, 7th, 8th, 9th, it's consistent, they're high risk. It doesn't seem to be improving. So that's kind of striking me a little bit. And then on top of that, if you have students that, let's say they're in 6th grade now, and if 70% of these kids are at high risk, somewhat risk, how does the teacher teach a classroom of this varying amount? I mean, we have every grade level has so many kids in there that are at high risk, somewhat risk.
I think we're going to get to some of
yes,
that.
I'm hoping to see that, and I would like to see, too, this fast bridge comparison every year, so we can kind of gauge to see that this is
That's what we're
improving.
going to provide you
Because
with.
this is really difficult for a teacher to manage a classroom like this. So,
Yes. So I think we're about to touch on some of that, but if we don't, bring us back to that.
Could I just ask for some clarification? The Fast Bridge, is this across other school districts in the state that we can compare within the state to see?
There are some school districts in the state that use this. There are some school districts in the nation that use this. So when we look at that data, we can look, let's say, for example, I'm just going to choose like first grade because we have 2 different schools that are first grade. Yeah. So we can look at the data at the building level. We can compare that across district. We can compare that within the state, the schools that are using it within the state. I think it allows us to look at state. It doesn't allow us to look at state data. I didn't think so.
Okay.
District-wide, or nationwide. So the trick becomes, like, we can look at our VT cap data across the state, but it's not the same data. So it gets a little complex, but we're going to sort of talk about some of the ways that we hope to have teachers examining this data and using that to guide their instruction. So I'll just real quickly, and so I will just say, we're actually very thankful for Act 139 that it's putting an emphasis on reading instruction, because we haven't always had that emphasis. And what has happened, if you have been in education or followed education, there have been a lot of trends in reading instruction, and science of reading is not something that many of us were using for a long time because we thought we were using what was best at the time. And now we are seeing some major shifts in education to really say we need to be following the science of reading. And hey, here's a law that says you must follow the science of reading. And so we've specifically made some intentional pivots in how we are doing that to assure that we are looking at science of reading as we move forward. So just in the last 6 months or so, some work that we've kind of put underway, and we've talked to you about all this stuff in the past, but you might have, I want to just kind of pull it out because it is going to lead into some of the other work that we're doing. So in February, I came into the position in July, spent some time figuring out kind of where we were at, realized that we really didn't have a strong multi-tier system of support in all of our buildings, and we really needed to spend some time kind of diving into that. So we amended our title grants to create that coach position in February that was working specifically 3 through 12, where we felt we had the least structure in place. Then we sent a team to a response to intervention conference in Albany, which looks at how what our intervention systems might look like at different levels. And really, that team of individuals, which included representation from all of our buildings, came back, worked with the MTSS coach to develop a 5-year MTSS plan. In April and May, we had a literacy committee that specifically looked at K through 4. And the reason we targeted K through 4 is at that time, Act 139 was really targeting K through 3, where really you would be doing intentional reading instruction, but we are realizing through looking at our own data that we are far behind where we need to be. Therefore, we made a decision to make an intentional adjustment at Tier 1, which Jen will talk about all those tiers and what that means. That's universal for all students in terms of our program we're using when we instruct students in phonics. And we actually made the decision to use a program K through 4, even though the program is really, in an ideal world, really K2. But our 3rd and 4th grade students need instruction in phonics. Our high school students need instruction in phonics. It looks different when you're a high school student. You're not, it feels different as a high school learner if you're not able to read on grade level. So we have to think about what programs we're using so that we are really trying to meet the needs of those students. So we decided, okay, we are going to make an intentional adjustment to our programming. We had a variety of different programs being used, some with Fidelity, different people supplementing in different ways, everybody well-intended, but really we said we've got to look at a shift in programming that's research-based, that follows the expectations of Act 139, and we need to be pretty intentional about how we implement this, and we are going to do that K through 4. We hope that down the road it won't be needed K through 4 and we can scale it back, but right now we have that need. In the group that attended that conference in Albany said, this is really important work and we need not only, we need our administrators to understand this work so they can lead this work in their schools. So we brought a trainer in to work with our administrators and any teacher leaders that were available. Again, we utilized some of our grant funding, particularly the unused money that we received a waiver for, to help us jumpstart some of this work. In July, we shifted that position to a coordinator position that would work K through 12. Jen McNeil came on to do that work. I should say our MTS coach was phenomenal. She decided to move someplace warmer, so we naturally were in a place to make a switch there. In August, we did professional development pre-K through 12. I talked about this a little bit 2 weeks ago on professional learning communities and data teams. And so Jen is going to sort of talk about what does that term mean and how are we going to utilize that work. And we are then looking at making teaching and learning, these specific areas, the priority of our strategic plan for this school year, which I'll talk about in a couple minutes. So just to kind of call it out, some of the professional development we've done since the spring specific to this, we did a Train the Trainer in UFly, which is the program we're using K through 4. UFly stands for University of Florida Literacy Institute. It's a research-based reading and phonics curriculum for early elementary students. We trained an in-house trainer. That in-house trainer is now training all of our staff in that programming. We looked first at K through 4 core teachers who will be implementing the program. Many K through 12 special educators, some of our interventionists, some additional grade level teachers. We have some middle school English teachers who want to have the information so that they can support it or figure out how to utilize it. So we are continuing that training and we are funding that through our grant. We ran 2 courses this spring. One was focused on in the science of reading. One was focused K through 4, learning to read. One was focused 5 through 12, reading to learn. And then we focused some professional development on that multi-tiered systems of support. So we had that district team response to intervention. We had that on-site training, the PLCs and data teams. We also are in the process, and this is ongoing work, of training all of our schools on how to administer that universal screener, that FastBridge screener that we were looking at. And we are also sending our coaching team, which includes Jen as the MTSS coordinator, Bethany as our data coach, and Ellen Colvin, who is serving as a 50% instructional coach, are doing some additional, more in-depth reading on how to dig deeper with that universal screening. And we hope to have those individuals help work within our schools and within our teacher leaders to help people understand how to dig deeper into that data. And that also includes EduClimber. EduClimber is a data software that allows us to pull in the data from FastBridge, from local common assessments, from other data sources, and allows us to access reports at the individual school district level. So I'm going to turn it over to Jen McNeil. Yes.
So when you say spring, are we talking about like April?
I am talking about basically since last February when we started this work. So like the reading courses were kind of a semester-long course. But really, if you've probably heard me speak about this before, we received a waiver from the state of Vermont in November of last year that said, hey, guess what? You get all this money back that was unused in Title II and Title IV from fiscal year 23, but you have to spend it. And you have to, and spending that requires a lot of work to write approvable investments into your grant that then the agency approves, and there's a lot of time involved in that. So we capitalized on that and said, okay, we have this funds, what do we want to do with it? And we started rolling these things out as we were able to do that. So this is like really in the last 6 months, but you'll see a lot of it was concentrated at the end of the year. Our previous MTSS coach also happened to be highly trained in literacy, and that was Lindsay Ryder. She was a UFly trainer and began doing some of that work before we even decided to make the decision to move to that program. And then we've since trained Ellen Colvin as a UFly trainer who is doing that training in-house for our teachers. So some of that training was done in the spring. And then we had teachers who were paid for their time beyond their contracted day to do that training in the summer, and even it's continuing to get as many people trained in that piece. We have big plans for additional reading training moving forward. I didn't include any of that in tonight's presentation.
Okay.
Okay.
So they're trained, but I'm just trying to, what is the agenda for implementing their training to the students? Is
Yep,
that being
so-
implemented now?
Yes,
Or
K through 4 for our Tier 1, which Jen will talk about, Universal Reading Phonics Program.
So they are using that training currently?
Correct. And then we have additional people that are getting trained now and thinking about, okay, what might something like this, or what might the implications be at the middle school as our middle school people get trained.
Okay, so as certain grades are implementing now.
K through 4.
K through 4 are doing it now.
Yep,
Or
this
implementing
specific
it to the
program.
kids. Okay.
Yep, and then we have different groups of teachers looking at other programming. So Pam will sort of talk about this down the road too. What does our literacy programming look like as a district? And to a certain extent, although it's not the ideal way, in some places we are building the plane as we're flying it because we realize we have to be making changes now, and there's a lot of moving parts. So we're doing our best to onboard people and have them as prepared in sort of a structured way. So with Act 139, we said we have to look K through 3, right? So that's going to be the first step. Oh, now there's this amendment for K-12. Okay, what does that programming look like in the higher grades? I will also say that despite the amendment, and I'll talk about this a little bit at the end of the presentation, each school does a continuous improvement plan. All of you approved those continuous improvement plans back in the spring through the consent agenda. The Agency of Education required K through 3 schools to have a goal specific to Act 139. We in Rutland City required all of our schools to have a goal specific to Act 139. So we were kind of ahead of the game in that sense. And so all of our schools have a reading goal in their continuous improvement plan that they will be circling back to multiple times throughout the year. So I'm going to hand it over to Jen to talk about the multi-tiered system of support.
So what is MTSS? MTSS really is a systematic process that helps us ensure that all our students are receiving the time and support needed to learn at high levels. The foundation is really high-quality core instruction, and the key is that it's available to all our students. So it's really being sure that we're being equitable to everyone in our Tier 1 instruction. The supports and intervention focus not only on academics, which is our focus really tonight, but it also includes behavioral supports and social emotional learning needs of our students. MTSS is really a data-driven system, so it relies not only on these initial assessments that we're doing, these initial screeners like FastBridge, but it also relies on frequent progress monitoring at all the tiers so that we can identify struggling students. So often the system is represented by a pyramid showing these 3 tiers. And Tier 1 represents the core program. So this is where we're providing all students access to essential grade level curriculum and effective initial instruction. So in an ideal MTSS system, approximately 80% of our students should be successful when accessing universal supports. Tier 2, this is your supplemental interventions. So this is where we offer small group opportunities to practice and learn grade level essential skills that are taught in Tier 1. Typically 10 to 15% of students would need this additional support. And then our Tier 3, this is our intensive interventions. And this is more explicit, focused really on the remediation of those foundational skills. Typically provided for a longer duration of time, so both in the length of the intervention and also the time, so usually a chunk like more weeks, and then also longer blocks of time, so more than like a half hour, maybe hour blocks of time. And ideally that might be like 1 to 5% of the population. So again, the goal in MTSS, this system is ensuring that every child receives the additional time and support to learn at high levels. Generally, the classroom teacher is responsible for providing Tier 1 and Tier 2 supports because both of those are targeting grade level essential skills, while interventionists provide Tier 3 services. Special educators and other specialists may provide additional support as necessary within Tier 2 and Tier 3. It's important to remember that the tiers are fluid and cumulative, so Tier 2 and Tier 3 services are always in addition to Tier 1 services, so students should always be receiving that core 1 instruction, those access to those essential grade level skills. All students should be receiving that instruction. The supports are tiered, not the students, so we don't label students Tier 2 students, it's the tiers that are labeled. And students shouldn't live indefinitely within a specific tier, and so that's why the progress monitoring is very important, because that's going to determine when students can move or might exit a tier if they don't need that support anymore.
We have a lot of work to do.
Go ahead.
Sorry.
No, I was just, you gave us, what the ideal percentages are. Do you have the actual percentages for what our?
I do not, because each building right now, and I think this is maybe where Bianca was going, each building is doing the tiers a little bit different at this point. So one of the goals in the 5-year plan Bianca was talking about is to streamline all of our buildings so that district-wide we're doing services more consistently.
Is that information we can get?
Yeah, sort of.
Yeah.
So the tricky thing is, if you look at that assessment data that we shared, it's clear that 80% of our students are not in Tier 1 on grade level, right? So if I'm a 5th grade teacher and I'm trying to teach just 5th grade curriculum, do my thing, it says I'm a 5th grade teacher, my kids aren't there. So right now, what we are having to do is say, okay, we need to provide access on grade level, and we also need to be supporting the universal instruction so that we can get more kids there, because we can't just say, I'm only going to focus on 5th grade. If you don't have the skills necessary to be here, I don't know, figure it out, kid. Like, we would not do that. We need to look at what do we need to do in our 5th grade curriculum. This as an example, so that we can help close that gap for our students. And so it looks a little bit different, and it is a challenge. And so we have to figure out as a district how we are looking to close that gap while meeting those needs of all of our students and providing training to our teachers and helping to look at what supports we might not have available or we might have available. How are we going to use our resources as we start to look at creating a budget for next year to assure we have the right people and materials in the right places to support this system. But this is really ideally what it should look like. We should have 80% of our students are able to achieve in that tier 1. The other thing is, part of that work is really looking to outline what's called the guaranteed and viable curriculum, which I think Jen's going to talk about a little bit. And we have work to do with that because we might be trying to do too much, and that's preventing us from really targeting those real essential skills and standards that our students need to meet.
And Jen, one of the pieces that we're doing is building that MTSS system as a district so that it's more consistent throughout.
Right.
Bianca was kind enough to sit down with me several months back and really go over it all in great detail. I do appreciate that.
Right. And just to add, a lot of the schools are doing different interventions. So when you hear things like the WIN block and the updates and some of the others, that is some of the tier 2 supports that we're working on providing. So it's happening across the district. It just looks a little different in each building.
So, question. So you've got kids in the 5th grade that aren't reading at the 5th grade level, and you get to the end of the year. Do they go on to the 6th grade and then not read at the 6th grade level?
Yeah, it's a good question. There are many factors that are a part of that. But generally speaking, we wouldn't just say because you're not reading on grade level, you're going to be retained for so many different reasons. But what we would hope to do is continue to provide additional tiers of support to help that student be able to hopefully get onto grade level, whatever grade level, ultimately by the time they graduate, we would like all of our students to be reading at a 12th grade reading level. The reality is, as you can see in our data, that is not where our students currently are. And I think you will find many of our colleagues throughout the state and throughout the nation have similar data there. And so you will see that there are sweeping reform efforts to try to help nationwide with that. The passing of Act 139 is one major step in the right direction to say, hey, whatever you've been using before, you can't use that anymore. So even though you have local control over curriculum, you have to be using science of reading techniques. And so that's like a hard turn where, the state is saying, we're going to push this down. And if you're not currently doing that, you need to make sure you get in line to do that. And, that is like both a benefit and a drawback to something like local control, which Vermont is, generally speaking, a local control state. So even in terms of what we're using for universal programming right now across the state, even across the county, we've got people using all kinds of things. And even within our school system, we had some disparity amongst what we were using. So when we talk about implementing something with fidelity, we have work to do to make sure that that happens. And hopefully by putting some of these structures in place, that alone is going to help us be able to close some of these gaps.
I think it's a good idea, the multi-tiered system. I guess what I think about is obviously that our results are benchmarked against something, right? Like if the whole nation was doing horrible, then the whole thing we would just be looking better. Mm-hmm. So we are being compared against something, and we are rating that. So, and I almost feel like this tier triangle could be flipped up.
And
down.
oftentimes it is. This is like a different way of looking at it.
And so I think in concept it's great, and I hear the training, and I hear that these are, I'm kind of wondering how close are we to making change, like currently? Or are we looking like next year? How does change?
I think we've made substantial change moving into this year.
Okay.
Particularly right now, starting K through 4. I think if you chat with people in the schools, they're going to say, yeah, there's some changes being made. We are going to continue, I hope, for a long time to continue to make changes, because that means we're really looking at our data and looking at the needs of our students. I think when you stop looking at what you can improve upon, you get kind of stagnant. We could say all the reasons why we might be in the place that we're in right now, but the reality is that this is the place that we're in right now. And so if we admire how long that's been happening, or why that might have been happening, or, oh, well, you know, COVID and this, that, and the other, all those things absolutely have impacted how we have gotten to this place. But the reality is we need to look forward, and how we're going to close that gap and make improvements. We have to start somewhere. The data isn't pretty, and we need to look at that and analyze that so that we can hopefully start to make the data look nicer. Because it's really our students who are impacted by this.
From what I can tell and what I've heard, it doesn't sound like we're that far off from other districts, not only in Vermont, across the country, in terms of literacy reading data. But it should be interesting then to see eventually how that 51% of students with plans intersects with this, because I think that is something that is more unique to where we are.
Yes.
Is the high level of needs. So I applaud the work that you're doing. This is a tremendous task to undertake, so thank you.
So bringing this back to the strategic plan, these are two of the objectives in teaching and learning. They both happen to fall in the assessment category. If you really dissect these, especially with an education brain, they are pretty weighty, heavy objectives. These are not 1 year, oh, yep, we'll just do this thing and flip this switch and look, we've got all these things in place. I mean, the first one speaks really to looking to adapt and adjust instructional practices. That includes the programming we're using, the training we're providing to our professionals, the work that's happening every day. And those interventions talks about that tier, that multiple tiers in there, based on our student data. So we have to look at our student data and outcomes in order to make sure we're aligning to this objective. The second one that's listed there talks really about building that MTSS system, but you got to build it, you got to support it, you need to align it across grade levels, cross-disciplinary. We're not there yet. That's like a down the road thing. What are our structures for reviewing that student data? And Jen's going to talk about that in just a second. How are we looking to update and refine those assessments, impact our instruction, and provide robust interventions? That word alone is saying, hey, there's going to be some growth that's going to be multi-year work in order to do that.
So one system that we have in place that we're really using to facilitate a lot of this work is our PLCs, or our professional learning communities. So this is where teams of teachers who either share the same content, like at the high school level, maybe the chemistry teacher, all teach chemistry, or they all teach the same math content, or at the primary levels teach the same grade level. They work together. This is where they're working to identify really what is the guaranteed and viable curriculum, and really identify what are those tier 1 essential standards. They review the assessment data, so whether it's the FastBridge data, the common local assessments, make adjustments to the instruction based on the data, and then identify supports for students based on the data that they're collecting.
So I will say, when we are you going to talk about guaranteed and viable?
Not in that one, no.
Okay, so just real quick, guaranteed and viable. So guaranteed means all students are going to get that instruction. We have noticed that sometimes a student who might be receiving a higher tier of support, in the past, perhaps they were taken out of that core instructional time to receive that support. But if you look at that pyramid, you need to receive that core instruction, and you're layering, right? So you're layering that on. So guaranteed means everybody is getting that curriculum. Viable means you actually have the time to teach what that is. And so the work of really identifying and narrowing down what those essential skills are, so you can target that. You can't target everything that a student is exposed to, because there's not enough time to do that. So how can we be really intentional about these are the things we are going to target within that MTSS system?
And so that really goes along with the first kind of two questions. I've renumbered it for you in there. But 1 and 2, the first two questions, what do we want all students to learn? And how will we know if they have learned? Those really align with building strong Tier 1 instruction and common assessment. So really, like Bianca was saying, identifying what are those essential standards that we want students to know and that we want every student to know in that Tier 1 system. The last two questions, and that's where when we look at the data and the data is not great, we say, well, what are we going to do about it? We have to look at it and see, well, what are we going to do if they are experiencing difficulty? But then also, what are we going to do if they do already know it? And so that connects directly to the MTSS process because we're ensuring students who struggle receive the timely, targeted interventions. But then also we have to think about those students who excel, and we want to have a plan so that we have extension opportunities for those students as well. So together, this framework helps us guarantee that every student is supported and also challenged through those extensions, which is, I think, also a very important part of the MTSS process through this systematic approach.
Yeah, what you see up there are fancy bullets, the bullet points.
Yeah, they got
just fancy bullet points. But I will say that this training we did just at the August in-service was like the first brush of, okay, let's get everybody pre-K through 12 to understand what a professional learning community is, because oftentimes that term is used incorrectly, like, oh, it's any group of teachers that meets together to talk about anything. And really look at, okay, this is how we're going to have to structure ourselves as professionals so we can dig into that data. I will say that the high school has had professional learning communities in place for a very long time. We actually brought back a trainer that had been in our district over 15 years ago to do that initial work. I would also say that if we look K through 12 across our schools, some have better systems and structures, some have better resources. So now we need to align those things so we have both of those things happening in all of our schools.
So one of the questions that I've been asked about the strategic plan is, so how are we going to know if the plan's been successful? And so the answer is pretty easy. It's really student data. And so our overarching goal in the area of teaching and learning is one for literacy, one for math. And so in the area of literacy and math, that over the next several years, 80% of our students will meet grade level expectations in both areas. And to break that down for an annual goal, so for this year, by June of 2026, each grade level cohort will improve their performance on identified literacy and math assessments by 5 percentage points when comparing their fall and their spring data. So as I said earlier, we're administering FastBridge this fall, and then when we take it again in the spring, we will compare, and each grade cohort will look to see if they have improved by 5 percentage points.
So then, are you going to use the data and really look at implementing the MTSS across to provide the coaching where needed in the different schools? Okay.
Yep, you got it. Good. And so that's the next slide. No, that's really okay. It's perfect segue. Thanks, Lauren. To meet the goal, we're working on a number of different steps. You heard about the professional learning communities, the multi-tiered system of support. So we're working to align our grade level standards in both literacy and math. So that's really identifying the skills and concepts that we expect our students to master at the end of each grade level. We're developing and implementing the literacy and math programs with fidelity. Developing our common level grade assessments, such as the FastBridge screener that I was referring to. We'll administer those assessments in the screeners and compare our students' progress with their grade level peers nationally. We'll also use the PLC structure to analyze data and identify students in need of additional instruction and to help inform our teaching methodology. We'll build and restructure our MTSS district-wide. And one of the other, tying in another priority from the strategic plan is aligning the allocation of our resources with what we say our programmatic needs are, including our professional development, our resources and materials. And I think about the work that the Resources Committee did last year to analyze our continuum of services, where they were able to identify gaps in our multi-tiered system of support and our system of support so that we could begin to target those and to provide the professional development and work on such things as the multi-tiered system of support.
And so the district has a continuous improvement plan, and each school has a continuous improvement plan. Our district goals that Pam was just talking about, as well as our plan, aligns to our strategic plan. And then each school's continuous improvement plan aligns with our district continuous improvement plan, also aligned to the strategic plan. And so as a part of the expectation of the Agency of Education, although they don't ask us to report this to them directly, each school has to evaluate and assess their goals and their progress on those goals several times throughout the year. And so we are hoping to weave those updates into the strategic plan updates that we provide to all of you. I will also say that both FastBridge and EduClimber allow us to really look at an individual student's growth as well. So you look at those different colored graphs and you say like, oh my gosh, there's so many students, you know, in the yellow or in the red. But we can also track an individual student and say, okay, the student was in the red here, and now, you know, they might not be at green yet, but they're at yellow, and that's a huge win as well. So we're looking at those individual students. We're not going to present to you on individual student data because that wouldn't necessarily be helpful. But, you know, what are those kinds of things that we're seeing for individual students as we provide different tiers of support and structure?
That was a lot of information. Thank you for your attention. Do you have questions?
Very bad.
So,
And then Charlene.
thank you for all the work that you guys have put into this. I feel like the last this is my 5th school year on the board, and, you know, data is always talked about, but the action of you guys showing it to us and Marie is like really huge. And I know that was one of our big things back in June is we want to see the data. Like we, as a whole group, need to see it. While we know the numbers are not pretty, but as you said, you can't look at necessarily in the past. You have to start from somewheres. And so thank you to you guys for putting this together to really help and benefit the students and the teachers and everybody involved in making our students get up to that 100%, hopefully. So thank you. Like, it's big.
Yeah, well said, Stephanie. I think this is an incredible amount of work, so thank you very much to everybody who's involved in all of this. There's so much data, there's so much going on here. I have a question that is not loaded, I promise. I mean, it's more designed to help us look for maybe an answer, right? And I know that we've talked about it sometimes in agenda meetings and like in other places, and I know that we do not have the space or resources for universal pre-K. But as educators, my question is not judging us for not having it at all. It's not a judgment question. It's, do we think, like, how much of an impact do we think that would have if all of these kindergartners came in with a full year of pre-K? I don't know who wants to answer it first, but whether it's...
It would be significant.
Yeah.
I mean, it would be life-changing for all of our kids to help provide equitable resources for every student prior to kindergarten. It would be
Incredible,
substantial.
right? Yeah.
And without that pre-K experience, a lot of our students coming into school are learning to be learners. They're learning to socialize with their peers. They're learning many other things that are hard to kind of measure, but definitely impact their ability to learn and access their education. And I would say that's true with all of the other, some of the other data point we looked at in regard to demographics, okay? When our students are not, when they are unhoused, that is definitely impacting their ability to learn when they come into the classroom. When they are living in poverty and they don't have access to basic nutrition, all kinds of different things that is impacting their ability to learn. It is not an excuse for us, but we need to consider those things and think about how we are preparing our learners to be ready to learn so that then we can teach them how to read.
Yeah, okay, that's fair.
When's the next Fast Bridge screening scores coming out?
So right now we are in the process of doing our fall screener with all of our students. If you look specifically at the end of year and the fall, it's going to be a little tricky. It's almost like an apple to orange because it's not exactly the same assessment. It's the beginning of the year assessment versus the end of the year assessment. That testing window is kind of long. We have some schools that are doing that a little bit earlier, and then like our primary buildings are taking a little bit of time to let students learn to be learners before giving that assessment. But we have a fall window, we have a winter window, and then we have a spring window where we are administering those assessments. And then from that quick screener, oftentimes we administer additional screeners for individual students based on the results of those.
So this test here will be given in the fall, like now?
Yes. A similar test, yes, will be given now. What you're looking at is the end of the year data. So the end of the year data next year would be the most comparable to the end of year data for here. But we are also looking to take our beginning of the year data and compare that to the end of the year data.
But this is a
Does that make
snapshot
sense?
of spring.
Correct.
And we're going to get a snapshot of fall.
We will.
Okay. And so it's a little difficult for us because we can't plan what's going to happen next, and then by the time we get on to this subject again, we've kind of forgotten what's happened. So I'm trying to, for me, this is a very important day to talk about some of these issues, because this is kind of very important, I feel. So will we talk about the fall scores when they come out? Will you have this same thing? Will you be coming to the board to talk about that, or is that not on the agenda?
How long does it take to get the scores once they've taken?
We wouldn't be ready to talk to the board about that based on your meeting schedule until probably December because of where the testing windows are in all of our buildings. We could think about where that would be most appropriate to weave in if that is part of a strategic plan update. I would also say that the fall screeners are happening now. So the spring screeners happen pretty close to the end of the year. Fall screeners, I wouldn't predict would be significantly different than the spring data because we haven't implemented anything yet.
Right.
For example.
Yeah.
So we haven't implemented a week or two worth of our reading program, right? So I don't know that that data is the best data for you to absorb, but we certainly could share it when we have it.
Well, would you want to know if it's worse than this? Yeah, I really, if you're saying, so I'm just, I hear what you're saying, but I'm also thinking, when we have these testing, it'd be nice to stay on top of this. I guess my only final thing would be, thinking of the sixth grade, who's received the fifth grade now, the sixth grade people, is a student who is, if you have 36%, whatever, that are in high risk, is that student receiving the core instruction the same or internal, understanding it as someone who is advanced or low risk?
No, the individual student's reception of that core instruction is going to vary greatly based on where they're at in that continuum. I will tell you that the process we are in right now, and we still have a lot of work to do, is helping our teachers understand how to look at the data and what the data is to then know how to respond. Schools are also in the process of saying, okay, let's dig into the data that we have. Let's figure out what our system needs to look like, because in a lot of places our systems are not operating the way we would like them to, and start to identify which students we would target where for which tiers of instruction on which skills. So that process is kind of happening right now while we are still trying to say, hey, here's how you look at this FastBridge data. Here's how you operate as a data team to allow you to look at your school or your class data to think about your instructional practices. We ask that teams do that through a professional learning community so that they're not working in isolation. So that if I'm a 5th grade teacher or 6th grade teacher and my students are showing that something that's happening in my classroom is helping them be really successful, I can share that with my colleagues so that we can try to duplicate that.
Which is,
Okay,
it's
sorry,
great,
yeah,
it's just
yeah,
the professional learning the professional learning communities have been happening for a while. So I feel like
In some places.
I'm just trying to figure out what the improvement would be, because it seems like 6th, 7th, 8th, 9th, 10th are in dire need at the moment to figure out, okay, how do I give this core instruction when I have this vast difference in high risk and low risk?
Yeah, so I'll tell you, I would argue that they haven't all been operating the right way, and that's why we reset that training for everyone. For example, I was a member of a professional learning community in chemistry for a very long time, and we were looking at chemistry, which was great because I was a chemistry teacher. We were never looking at reading data for the school and how that might impact a student's ability to access my chemistry curriculum. So we are now working to shift that, and in fact, we have a teacher leader meeting in our strategic plan work that our teacher leaders guide. We're shifting how we use that time this year because we need additional time for our teacher leaders to be trained in looking at data and how that data team process works, because one day of in-service doesn't do that justice. We are also looking long-term to say, what does our calendar look like? Where can we support more professional development to help our teachers, have the time they need? And that gets into our resource conversation. When we have our budget conversations, we need to look at how we're allocating our resources, whether it's time, money, positions, whatever it might be, because if those pieces are not in place, we can't support this work in a sustainable way. So we are making some hard turns to say, yep, we're going to do PLC training across the district because we haven't had that operating in quite the way it needs to operate. So I would argue that, yeah, we've had some of these systems in place, but I think we're looking to do kind of a hard reset because what we've had in place is clearly not meeting the needs of the majority of our students. While we are doing that, it will take some time to get those systems up and going and to actually implement some of that. So I don't think we're going to see giant gains in our data instantly, which is why our goals are very specific to work for a long-term goal. Hopefully, we will see bigger gains than we've seen previously, but we've been doing kind of the same thing for a long time. And, the literacy committee had some really tough conversations because we looked at our data and we said, well, maybe it looks like that because we're not all implementing with fidelity. Maybe it looks like that because we're not doing this. Maybe if we use the same program we're currently using and we do it in this way, and we really had to kind of face the reality of we've done that for 14 years or however long, and it's not really yielding those kind of results. So we have to try something different. I'm hopeful about what we're trying. We will see if our data doesn't improve at all, then we need to try something different.
I think it's a fair ask, though, to get the data.
Yeah, I
think
I
it's
just
a
want to
fair
keep the
ask.
momentum going with the data only because I know everybody kind of struggles with everybody wants this to improve. I realize that, and I don't have the answer, and you guys are making strides to go that way, and I do appreciate all of it. It's just I feel like this is a kind of a hot topic that I hear a lot of frustration around, and I'm eager to see the fruits of your labor, of everyone, because I think it's tough for all the way around, because then it just keeps perpetuating every year going forward for the next set of the next year, and so
I wonder, as we think about our continuous improvement plan and action plan presentations that the educational leaders do in the spring. Actually, it's usually after the budget season we start those. If that could be a time in which we share some grade level data.
because this is a little piece of it. We're talking academics here, like you said, but there's also
right. And our next meeting, we're going to talk about
behavioral
wellness.
things, yes, and things like that. Yeah. it's a whole other thing on top.
So Lauren has a question.
In my understanding, Fast Bridge, fall versus spring, it's not pre-post asking the same exact questions. It is accounting for maturation and the advancement, and then so that you can use it throughout the year to assess where the children are at and how to adjust the intervention that they're receiving or the instruction that they're receiving. Is that correct?
Yes.
Okay.
Thanks for highlighting that.
Yes, and we are going to be looking across the cohort so that we are really comparing like apples to apples and oranges to oranges. However, the data we will look at will progress because the students are going to be advancing, right? So the 5th grade data, the same cohort is now in 6th grade. In 5th grade, we were measuring them on 5th grade. In 6th grade, we're measuring them on 6th grade.
So really looking at the progression from grade level to grade level is what we want to do.
Yes.
Thank you.
Yeah, I kind of continuing on your point, Charlene. Yeah, I think not losing sight of the data is incredibly important. And so I do think when we have the spring data from 26, being able to compare that with fall of 25, that's where we're going to get our real first glimpse, right? Because that's the same students, right? Because we even have some different, we can't really look at spring to fall, like you said, it's a little bit apples and oranges, right?
Yes.
It's a little bit apples and oranges, but we want to maybe still see the fall data.
Yes.
Because then we can be like, okay, I'm not sure we can make a whole lot of inferences from spring to fall, but we can certainly be like, okay, so this is now where we are, and then we can anticipate what's coming for spring, I think, right? Is that, yeah. Okay, thank you.
And part of Act 139 is that, and really effective this school year, is that we are reporting out to our families the results of those as well. The law says we only have to share that information for students that are significantly below, but it's best practice to inform parents of how their children are doing, regardless of that.
Yeah.
It's got to be a struggle for those students as well, and coming to school every day and kind of struggling a bit. It's anxious and anxiety. There's lots of stuff happening there. So whatever we can get to help boost this whole program is fantastic, which looks like we're on our way.
Yeah. Well, and like you said, we're not dealing with kids in ideal environments, so we're just looking, it's improvement, right? It's not perfection.
Right.
Progress over perfection, as we say, right? It's just.
We can't lose sight of the fact that we have this enormous number of kids under the poverty level.
Oh, God,
their way
it's
out
terrifying.
of poverty is through reading and being able to do math.
Yeah.
I was curious about the correlation between the poverty levels and how many were on, in the different tiers and between the schools, because there is a difference between them.
And we can drill down into the data in ways like that. Sometimes our cohort might be too small to really not have it be sort of identifiable, but things like poverty, our cohort is quite large, so we can drill into the data that way too.
Yeah.
Okay.
Thanks, you guys.
Thank you.
Thank you.
so much.
Thank you.
It's a lot to digest. Building.
Yeah, I gotta find me here. Hold on. So, building committee met last week, and we did we started off with a review of our summer projects. We've been talking about some stormwater projects for 3 years now, and at both RMS and RAS, they were finished this summer, so that is a nice way to finish finally of something that we've been hearing about. The RHS and the Stafford are also completed, and as some people saw driving by, there was a big hole, and it's a nice turning into grass now. One of my biggest things that of the summer projects was the completion of the life skills classroom at Rutland High School. That some of us have seen it in person, and it's amazing, and it lets us have our students who need the life skills in the building with their peers, as opposed to a building off campus. So it's just an amazing site, and everybody should go see that room. Stafford Technical Center, the auto tech classroom is near complete. Again, that's an amazing space that last time we all saw it, it was an empty space, and now it's full of lifts, and there was cars in there last week when I was in there. The new scissor lift, we thought was going to be in by now, but it looks like later this month that it will go in, because the concrete has to cure for a little bit longer than was thought. And then some northwest and northeast. Northwest, they did the walkway to the rear entrance and playground was paved, making it a little bit easier and safer during the winter months. So you kind of have a flat surface, not a rocky hill. And there was some mason work done there, a new wall built at northeast. On our consent agenda, we had a bus replacement. So we would be up for 2, but we're just going to replace 1 for this year, and we did approve that in our consent agenda. Also in our consent agenda was the fence that for in the area of the RAS playground. So we approved that, and that will be, hopefully, the goal is to have that in the sidewalk area done, but some parts of that are, the city is waiting on some of grants and whatnot to finish that. And there will be stump removal, so hopefully that can get done before we put the fence up, or otherwise.
Stumps are gone.
They are?
Yep. It's right down the street from me.
I
was walking my dog by it today.
Today? That's amazing.
Today,
so
they're
anyways,
gone, just so we know.
Yay, so that means our fencing can go up and we can get rid of that red, orangey stuff. Fencing. That's just atrocious. But anyways, we also discussed in committee and about replacing the light bulbs at Alumni Field. There's a couple different numbers, and we, as a committee, decided to go with just replacing the existing light bulbs as opposed to new fixtures with LED lights. The difference is roughly $10,000 to $15,000 for just the light bulbs, and then the fixtures themselves would be a total of $210,000. So just kind of for where we're at right now, it just makes more sense to replace the light bulbs. We also discussed in committee, we had a letter from the community member in that we discussed, and Superintendent Reed did respond about that. And our next meeting is October 7th at 5 o'clock. And I do want to say, I know I say it a lot, thank you to Glenn and your team. Everybody, from not one person in your team did not help do something within our buildings, grounds, the whole shebang this summer. So thank you to your team. An endless thank you. So.
Any questions for Stephanie? Mary Beth?
Am I up?
You're up.
Okay, I'm up. All right. We also met on Tuesday, September 2nd for the Finance and Strategic Planning Committee. We covered 3 main topics: fiscal year 26 spending, and how it compares to the budget, a recap of some preliminary assumptions for fiscal year 27, and a timeline of actions related to Act 73 for the exciting education transformation coming our way. First topic, regarding the outlook for fiscal year 27 spending, Ted Plemenis, our CFO, said that staffing at the start of the school year is lower than the number of employees who are budgeted for fiscal year 26. I think we saw that a little bit with the superintendent's report. He said that certainly natural attrition from retirements and resignations, which normally occurs in the spring, have not yet been fully offset by new hiring, again, as Pam outlined. By starting the year with fewer employees, than budgeted, our CPS will realize some unexpected cost savings, of course, from lower salary and benefits costs over the next few months, even if we do end up replacing or filling those vacancies. The extent of those savings obviously will depend on how long it takes us to fill those vacancies. The conversation did then take a turn, which was incredibly relevant to what we talked about tonight with the data and all of that relating to student success. I think the Finance and Strategic Planning Committee was incredibly concerned about, lower staff levels and how that might impact the great work we're trying to do with our strategic plan and the data that we saw tonight. So I do want the public to know that we are, while we are incredibly fiscally conservative, that's the wrong word. We certainly try to be fiscally conservative. We also don't lose sight of what we're trying to do in ensuring that our students and our staff and faculty all have what they need. So, as I have in my notes here, excuse me, I have something going on. Hold on. Anyway, the possible impacts of lower staffing on delivering educational services and still being able to achieve our strategic plan goals. So we're trying to balance those two, as we always are. That was a pretty hearty and long discussion, actually, in that meeting, which was, I think, incredibly important. When we did return discussion to our financial outlook of 26, Ted gave a recap of the estimated increases in costs this year associated with salaries and benefits based on, of course, our contract recently agreed to with the Rutland Education Association professionals. The new contract is estimated to add more than $750,000, about $850,000 over the approved budget for salaries, payroll, taxes, and other benefits. The committee reviewed several ideas for rebalancing the fiscal year 26 budget within, so that we can keep it within our $67 million total expenditures approved by the school board and by our voters. The administration will continue to work on developing those initiatives in the coming months. So then we turned our attention to fiscal year 27, because of course that planning, Ted and his team is of course beginning that planning now. The committee reviewed assumptions for the fiscal year 27 budget, including factors that will impact salaries and benefits, which of course comprise 80% of our budget. Again, 80% of our budget is salaries and benefits. We also consider assumptions that impact revenue projections, including uncertainty about federal funding and updating tuition fees for students from other school systems. In September, administrative leaders will begin discussing staffing levels that are expected to be needed in fiscal year 27. Ted commented that with the cost increases that are already baked in for 27, I like that word, Ted, baked in, that's good, it would not be surprising for total cost to increase by 5% or more year to year, assuming steady staffing levels, unless additional cost savings are identified. And then our last topic, of course, as I mentioned, was Act 73, which was signed by the governor on July 1st. A key point is that Act 73 will not change the annual budget process for either fiscal year 27 or 28. It will not change how the school funding formula or student metrics are administered for those next two budget cycles also. I think is a little bit comforting to know that we're pretty steady for the next 2 years in terms of how the funding works. Those changes, any changes will not take effect until fiscal year 29, when on July 1st, 2028, when the new school districts are expected to begin operating. Between now and then, there will be many developments, new standards, and other factors certainly to be considered and planned for. Our next meeting is also on Tuesday, October 7th. We do 6 o'clock and follow building committee, of course. So any questions on the excitement that happened at Finance and Strategic Planning? Okay. Thank you. Thanks, Ted. Those gives me great notes.
Do we have any unfinished business? One unfinished business. As far as new business goes, we have our board retreat scheduled for September 23rd, Tuesday, and Thursday, September 25th, in the library at the high school. We have food at 5:30. The meeting begins at 6 to 8. And there is some homework in your email that I received from our facilitator, Debbie Singizer. It relates to board self-assessment, superintendent goals, and some other relevant information. Oh, sure, go ahead.
I also want to, as new, it's not necessarily new business to us, but just to kind of let the board know and the community know, I will be running for one of the regional reps for the VSBA. So that, the election is on, it's a Zoom on the end of this month, so please look in your emails from the VSBA and really look at that and come listen, and there'll be lots of good information there. And it's broken out by region, so, or by not county, it's like a region essentially. So I am just kind of wanting to let you guys all know that, and hope that you'll come join and vote for me.
So the voting will happen at the Zoom meeting?
It will happen at the Zoom meeting, yes.
You tell the date again. You let us know.
It's, I want to say September 30th, but I screw up the October 30th.
The 30th.
Date. Is it the 30th?
It's the 30th, right, Pam?
Yeah. I believe it's like
Is it at the
5:30 to
meeting?
7:30 or 5 to 7.
I don't know.
I'll be sending out my blurb and whatnot, and it will be in there, and you'll get information of if others are running as well.
Thank you.
Yeah.
Thank you.
Thanks.
No executive session?
No executive session.
Okay.
2 meetings in a row.
So, motion to adjourn.
Second.
Any opposed?
I just want to stand up.
Motion carries. Thank you, everyone.
2030.